March. In Singapore, there's about 6,000 people confirmed is a confirmed case. Refer to Singapore population in total is about 5.85 million. Yeah, so the majority import cases are import cases actually. So during last year, I think to your country and here I should be ever encountered the same situation that people are running for all the essential supply like tissue paper, instant noodles, all the foods. Yeah, same thing in here. So after that, there's some social distancing we have to follow. So you can see the pasar, even though it should be very crowded area, but people usually still can find a way to follow the social distancing policies. And in our Singapore Hawker Center, quite famous. So as a traditional vendor, food supplier, actually not so many digital appliance or digital things in the market, but because Singapore, the government, they are support on that. So all the hawker centers so far, they are start to have digital business, like they join the Grab Food Panda, so that they can get the money to continue their business. So same thing, during the pandemic, people less to go out, so they start to have their handmade bakery or handmade food. Now they start to have a business at home. Is quite common in Singapore as well. So review the Singapore government, how they deal with COVID-19. There's 5 strategies into the look. So first of all, the mask policy. I'm sure your side you also facing the same issue, right? So in Singapore, government, they provide the washable mask every 2 to 3 months, so that it can maintain all those low income people. They can still have sustained mask to use. And the circuit breaker since last year, April to June, it was lockdown, considered a lockdown. So all the except essential business can continue go on. The rest, they are have to close fully. So going through that, we so far we start to learn how to wear mask all the time in the public, and keep the social distancing. And currently, you can see there's a more high-tech technology or application it go around in the world, of course in Singapore as well. So vaccination, there will be the last part, but and this part since this year February, we start the frontline staff start to having to receive the vaccination. Then moving forward, now we are moved to all the seniors. So sometimes in the park, you can see some of the robot. It's a robot dog, as this photo. It's a robot dog. It aims to tell people have to keep social distancing. And we also use some of the trace application to trace everyone, to prevent that whoever contact with confirmed case, then we can trace back and to try to stop the train of the transmit. So how about Singapore healthcare frontline? First of all, I would like to introduce my hospital, Raffles Medical Group. Is a company. We have different area to share. Is operate in a medical facility in cities across Singapore and China, Hong Kong, Japan, and Vietnam, Cambodia. So Raffles Hospital is a private tertiary hospital located in the heart of Singapore. So we offering the comprehensive range of the specialty medical and diagnosis service in inpatient and outpatient. So it's the only private medical provider in Singapore that owns and operates a full integrated healthcare organization comprised a tertiary hospital, a network of family medicine and dental clinic, insurance service, Japanese and traditional clinic, medicine clinic. So Raffles Hospital is a JCI accredited since 2008. As a member of the Mayo Clinic Care Network, our healthcare professionals have access to the finest medical expertise from the United States right here in Singapore. So as part of healthcare provider, Raffles Hospital is assigned to support the safeguard general public in terms of medical needs. So as you know, Singapore is very small. So all the confirmed case, we have a center we call National Center Infection Disease. All the confirmed COVID-19 cases we will transfer to there. So before we find out is as a confirmed case, or when patient has find out is confirmed that it's a COVID-19 cases, before his vital sign status stabilize, we have responsibility to take care of them until they are stabilized in condition. Then we transfer to NCID. So from this part, actually in the short period, the patient who stay in our hospital, that we need to find out how we can make sure the social distancing policy and still provide the good quality care. So we trying to return back to the basics, try to review whether we have any strategies to help this period. So we found out from during the COVID-19, the MDRPI are more prone to see because maybe we are all wear the PPE precaution, so it's more easy to happen. And I'm sure you will know there's some photo in the international. They share about the staff within the pressure injury because wear the N95 or goggles. Yeah, so this is what we need to look at. And besides the patient, when they're using more medical device, so it end up have more MDRPI. So usually at this kind of case, we will use prevention more than the treatment. So before it happened, we will use the foam dressing to maintain the skin trigger. And during this period, you can see the telemedicine is created a new door to quality of care. Last time, we always think about they will have moralities concern or PA concern, and we are afraid to transmit all the photos online in order. Then, but during the pandemic, there's too many restrictions. We have to keep the social distancing policies. So although the WhatsApp and Skype, Line, or even now Zoom, we are using to share our knowledge, and also we use it in the medical communication with family or the patient. And some more like the community care. some of the nursing home in Singapore, they are start to having to implement 3D wound management application in start from 2019. There's some more integration the computing systems to come into the Singapore to have more business on this. And of course, from this point, we can expect the service, the hospital service is able to extend to the home, and even the caregiver training. So from our hospital case, we usually use WhatsApp to share our knowledge with patient or the caregiver. Some more, it can be a way to communicate with family to reduce the misunderstanding, and to even can help the family to know more about the service that we want to give it. And some more, another one, the YouTube video is also a way for the caregiver and expert to gather the different idea in one simple care for the patient's daily basis care. So for my small tips, usually I will ask the family to ask the permission from the family. So the family will be more keen to understand, and when they are more keen to understand, they will agree for use WhatsApp or Line, this kind of equipment, the application. So from there is get patient families agreement that is a secure or a PTPA consent. So from there we can start to can have more communication without the social distancing limitation. So, and this moment we found out the negative pressure wound treatment is become a popular dressing during the pandemic, because it's good at manage the acute, right? And it's a fewer, so that we can lesser appointment with family, with patients. So and currently there's quite a lot of home care products and service is happen. So I think it's a good trend to us to have more choice to help patient one case at home. So this is one of a case, my case, 35 years old Chinese lady. She had been dehiscence wound over the abdomen. It was 12 centimeter long with a depth at 1 to 1.5. So we use pico dressing, one of the negative pressure wound treatment dressing for 2 weeks, and subsequently we use some of biotin alginate AG, then combine with collagen dressing, so it can heal that abdomen wound healing in 1 month. So it's quite fast progress. So I think to negative pressure wound treatment is a good good example. So during this pandemic, we do review our management, whether in Raffles, whether it's good enough to support this pandemic seasons. So there's hospital acquired pressure injury is a very typical and very key indicator in care, quality of the care. So before pandemic, we conduct a scheme bundle to trying to improve our service and to prevent HAPI. So it's a time to review. So I would like to share with you about how are we doing the scheme bundle in our Raffles Hospital. So in scheme bundle, there's 5 elements. So surface skin inspection, keep moving, incontinence and nutrition and hydration. Each of one are unique. So there's different layer, different concern in between. So like for surface, we will look at the environment, like sleeping floor or any grabbing bar. Is it good enough? Is it enough for patient to grab? And is there any bed sheet or closed fold underneath of the body, especially when patient is bedbound? And if is it the diaper size is too big or too loose, or is the diaper type is too tight? So like all those very final thing, we found the surface from the environment first. Then subsequent we go to the skin inspection. We teach the staff how to watch patients' skin condition, and is there any fungal infection happen that doesn't solved before they admit. And some more like especially obesity patient, they have a lot of skin fall in between, that it will hold the humid in between. So all these we will in detail to tell them and teach them. So subsequent, we will look at the moving. We always believe active always better than passive. So we will provide in order to prevent the further deterioration and pressure injury. Reposition technique is very important to know, and the physiotherapist is recommended to join us to fight with the condition. Then incontinence, as I believe all of you are aware about all the skin, the urine and feces are very alkaline. So it will damage the skin very fast, maybe in 1 day. So especially in elderly, we are very care about this. Then the last one, nutrition and hydration. The nutrients is like protein and water. The minerals, they are essential to the wound healing. However, the kidney function, whether it's sufficient or not sufficient, is a very key point to consider their condition. So there's 5 elements to think about. So besides the skin bundle, we also provide sort of skin and wound guideline and solution for our primary staff in order to let them to follow and as a reference. So we will provide like reposition, how to reposition, what kind of position will cause pressure injury, and what kind of equipments that we can use to prevent pressure injury. So the pressure injury, we will talk about the staging. What is the staging that we like to, and what is more concerned to, like deep tissue injury and unstageable, which is we are really don't like this, because this tool in our management is more time consuming. So like for example, DTI, if it's because DTI is come from the injury is come from different level of the in vital tissue, so we have to wait for it to become like unstageable. So only foam, we will use the foam dressing to divert to offload like air mattress, or use the air mattress or the mattress, the cushion matters to divert the pressure. Then when the pressure injury become unstageable, we will based on the age and his general illness and sepsis condition to judge either we need to go further to do debridement or just hold off until patient's general condition recover. So we also provide the IAD guideline. The IAD guideline, we will give not just the location and what to do, and we also will show them in the photo to teach them what is the condition like, and what kind of dressing product that they can use. And our role in wound care, we will make sure the outcome. So we will provide the products are accessible. So as what you see now, there's Easy Cleanse and the barrier cream. These two we are quite familiar to use, and in our exam, in our test, we found out it's better than 3-layer technique, because because every shift nurses they will continue to do the same thing, and it's easy for them to follow in Raffles Hospital. So we also provide a skincare guideline. The skincare guideline not just talk about the 3 types of skincare. We also provide the way to let our nurses to have a standardized operating, so that we can make sure they won't have secondary harm. So it's like the foam dressing, how are we indicate from the dressing appearance, so that when the foreign nurses want to change the dressing, it won't harm, it won't damage the flap, remove the flap again. So to our skin bundle in Raffles, we trying to identify the problem earlier. It's aimed to trying to identify the problem earlier in order to prevent the deterioration of the wound. And we also to establish a SOP of the hospital-acquired pressure injury, and to provide a foundations of wound healing care. So from our exam, we review within the 2 years, it's really reduced the number of hospital-acquired pressure injury incidents from 0.83 per 1,000 person times, less than 0.5 per 1,000 person times. So the numbers of the HAPI stage 2 above decreased to 57% within 2 years. So throughout this 2020, the numbers of the pressure injury and IAD and skin tear actually are a little bit decreased because of all the pandemic conditions. So actually, we also still working on to continuously to look at to observe all the skin bundle outcomes, and we hope that in the future we can provide you more information on this. Yeah, so I think wound management is a long journey. Although we are in COVID-19 apart, COVID-19 apart us, but they always have a way to get up to out, as long as our mentality being together. So thank you for your time, for your listening. So this is my presentation today.
Okay, thank you, Miss Jasmin.
Yes.
This is a special material, the first material in the afternoon. So we wait for the question from the audience. Oke, buat semua audien yang mau tanya sama Miss Jasmin, bisa ditulis di kolom komentar ya, atau di kolom chat.
Sarah, I asked to Jasmin.
Yes.
Yes. Yes, Jasmin. I want to ask for you. Is there a different management of wound care before and after during COVID-19?
Wound care?
Yes, wound care.
in the wound care itself, it won't be different, but I think the trend will be different. Who is the one to take care of the wound? So initial, we are quite happy to let patient to come back to do the dressing. We have an appointment we want to make sure the wound is in right. But during the pandemic, a lot of things have to be restricted. So we will more teach the helper how to deal with the wound, how to observe the wound, and when is the time to come back to hospital.
Okay. Because in Indonesia, because
Yes.
Miss Corona, very problem in Indonesia, and algorithm to the protocol and procedure in Indonesia hospital and the clinic, the very changed before COVID-19, and maybe how is the condition the COVID-19 after being the vaccination in Singapore back to normal or still new normal in Singapore?
I think in this point of time, because just start from frontline, the frontline already got the shot, got the vaccine, and now move on to the senior. So it's still a lot of portions of citizens haven't getting the vaccination. So at this point of time, we still need to be conscious of aware about the surroundings. So in Singapore policy, we didn't change so much. We still need to follow social distancing, still need to wear mask. But I think in that situation, from the beginning, is very scared of how to deal with COVID-19. Now we are quite comfort in the sense to be in this situation.
Okay, very the policy in Singapore.
Yes.
Okay. Thank you, Miss Jasmin, for the answer.
Thank you.
Okay, Miss Jasmin, there is questions from the audience. Okay, are you ready? The question is, what kind of product to use pressure injury because bed rest? Hello, Mr. Jasmin.
Yes.
Okay, there is a question from Ayu Nirmala Dewi, the special one audience this afternoon. The question is, what kinds of product to use pressure injury because of bed rest?
Because of
bed rest.
Sorry.
Yeah. Bed rest.
Mattress.
Okay. What? Yes.
I'm sorry. The connection is.
The product to use.
Okay. In Singapore, there's many types of air mattress, or no matter it's gel mattress or air mattress. In company, in hospital, we will suggest air mattress, especially like two tubings instead of just one tubings. Yeah, so it's more easier to manage the pressure injury, and because patient need to turn and all that. So in hospital we have a standardized products, but I'm not sure whether in your site whether are the same. But air mattress would be the priority instead of compare with the silicone or gel mattress.
Okay, so bed rest injury is about like pressure injury, right?
Yes.
And we easy to recovery position in the bed rest injury. Okay. Kita lihat dulu apakah ada pertanyaan lagi. Okay, to all audience, if there is questions to Miss Jasmin, you can type in chat room. And I will be wait for 2 minutes again for the next questions. Okay, Miss Jasmin, I want to know in Singapore, are there more infected medic there? And there was infected, so how the way to solve it? Because we know that house care can be operated without the lack of medic.
Yes.
Are
So
you get the point?
yes, the healthcare it is like different hospital. We trying to not see each other. We only like have a party on the June, or we trying to not to meet each other. Then especially if to the healthcare family, like my family, we in Singapore. So when I will just try to make sure everything in the hospital I won't bring home, or when I bring home is have to clean up properly and try not to contaminate with patient with my family. Yeah. So I think it is still returned back to the main purpose, the base, that social distancing, the distance is really can help to stop the virus spread. Yes.
Okay, thank you. So I think enough. So to represent the committee, thank you for your nice material today. And
Thank
see ya.
you. Thank you. Bye.
Oke. Saya kembalikan ke MC sambil menunggu pembicara yang kedua ya.
Aisiah sudah ada, sudah ready, tinggal di Aisiah. You can hear?
Yes, good morning. You hear me now?
Okay. Yes,
Okay.
I can.
Okay.
Okay. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay.
Dikenalkan aja dulu.
For the next, for the next speakers is from Saudi Arabia, and his name is Eisiah Abbas, registered nursing, Eisiah nursing. She's from Jeddah Kingdom of Saudi Arabia, registered nursing and master science. And she's a diabetic food specialist, wound ostomy care specialist, master science dermatology skill and treatment UK. And in this opportunity, Ms. Eisiah Abbas will be share about their nice material around in management chronic diabetic during pandemic COVID-19 in Saudi Arabia. So I would you to help me to invite her to join with us. Hello, Ms. Eisiah. Assalamualaikum.
Walaikum assalam. Good morning.
Hello.
In our time, and good
morning,
afternoon in your
okay.
time. Good afternoon.
In
Are you hearing me well?
Afternoon. Yes.
My voice is okay? Okay, I'm Eisiah Abbas. I am wound and ostomy and diabetic food specialist at King Abdulaziz Medical City, Jeddah, Kingdom of Saudi Arabia. I am a registered nurse with master degree in science and for skin and dermatology skills. I am also a certified ostomy care nurse. I have been working in wound and ostomy for more than 15 years, and thank you for your organization for inviting me for this nice lecture and to share our experience in COVID-19 period with each other from each country. Thank you so much. I will start my presentation with giving an overview about what happened in Saudi Arabia since the start of COVID-19 till present. In between, I will speak about chronic wounds as you requested the topic to be about chronic wounds during pandemic. As an introduction for my presentation, the spread of COVID-19 has profoundly affected the way we conduct our medical practice, resulting in a decrease in necessary medical care, including the wound care, the wound healing specialty. The actual period of COVID-19 pandemic limits the ability to practice wound healing in normal condition. Especially in our country, many of the specialized wound care people and departments, they were shifting to bedside nurses to help in the crisis of the increasing of number of admitted patients with COVID-19. In many hospitals, they limited the work of subspecialty and they make it general to cover this period needs. As a background of my presentation, healthcare workers in Saudi Arabia face considerable mental and physical stress caring for patients with COVID-19 like all healthcare workers around the world. They are at a high risk of acquiring or transmitting the virus. All healthcare workers believe that the government should isolate patients with COVID-19, especially in the special hospitals, and agreed with a travel restriction that the government implemented from and to affected areas. And also they are happy with the government implementation of curfew and movement restriction periods, and that decreased the numbers a lot in our country. Detection of the first COVID-19 case in Kingdom Saudi Arabia. The Ministry of Health announced the detection of the first case in 2nd of March 2020, last year. And by 9 of March, the cases raised to 20 cases in Saudi Arabia and the whole country. And most of them, they were coming from outside. All social events was canceled by that time. They start from the beginning. This is why we didn't have a big crisis like other countries. All educational institutes and governmental agents closed to control infection spread. On the 21st of March, the Kingdom of Saudi Arabia announced the suspension of all flights, buses, trains from outside the kingdom and inside the cities of the kingdom as well. And this has reduced the number a lot. The government isolated all currency imported from outside for a long period that they are sure the virus is already killed before releasing it. Additionally, it imposed a public curfew starting from 19 till 6 a.m. every day in the beginning. And then after that, they extended from 1500 hours to 6 a.m. in most of the cities. After that, they make it total curfew or lockdown, especially in Ramadan and Eid days. Providing residents supported or sponsored by the Ministry of Health for employee working with COVID-19 to help them to be away and isolated from their families, even if they are negative, but sometimes they don't know yet if they are negative or positive. So better for them to do duty and go to these isolated houses and to take few of days to stay with their family to ensure they are clear. Enforcing 14 days home quarantine for all employee returning from outside when they accept for them to return. But in a period of time, they stop even employee in healthcare to come from their houses or their cities or their countries. We experience very shortage in staff because many of our nurses, they were away on their vacations and they were quarantined there and they were stopped. The flight was stopped for almost 5 or 6 months. So they were isolated at their homes. The roles and responsibilities of emergency medical system have received little attention also. The previous slide, please. The clinical recommendation for emergency, no, the previous one. Before. Previous slide, please. Yes, okay. To provide a reserved area with the diagnostic materials for all suspected cases to provide early result of diagnostic tests, avoiding the crowding of patients, required care for other illnesses also. Many of our staff in the hospital, they were screened for COVID-19 every period to ensure that every staff, maybe they get the virus, but they don't have symptoms. So we were screened like every month, do the swab and then see the result before attending to our work in the hospital. Next, please. In reaction to COVID-19 pandemic in my country hospitals, this was the protocols and our experience. For the hospitals in general, multiple measures have been taken to decrease hospital-acquired infection. Allocated limited hospital resources, especially ICU beds and ventilators. We have ICU beds and ventilators, but because we understand from the crisis happen in other countries that it might not be enough, so they give the priority for allocating more equipment to help patients during the crisis of the virus. We follow the World Health Organization 2007 guidelines regarding infection prevention and control of epidemics and pandemic in healthcare facilities by providing appropriate personal prevention equipment to healthcare workers and to prioritize the suitable medical services and procedures. That is why when they prioritize the service, they felt that wound care service is not the service which can be run the same like before, because coming of the patient to the hospital to take the care or for proper wound assessment will make them in danger for getting the virus infection or translating it to the hospital and to the employee. Other administrative measures in the hospital environment include the screening of patients and healthcare workers entering the hospital. At each gate in the hospital, we have screening tools, and we have that to check the temperature, and we have to ask the patient a few questions about what symptoms they feel, or if they have anybody sick at home, or if they already was positive for coronavirus, so they will not allow him to enter the hospital from outside. So this was running starting from March last year till now, also with the new wave of coronavirus. In the Kingdom of Saudi Arabia, COVID-19 pandemic necessitated modification of wound care practice to protect patient families and healthcare workers and minimize viral transmission. As an example, in our hospital, we ask all the patients with chronic or acute wounds not to attend to the hospital. And we were dealing with our chronic wound patient. We were following them up with this telemedicine. They call us anytime and they send pictures for their wounds so we can evaluate. I'm sure, yeah, it will not be the proper assessment, but at least we can evaluate the wound and the status of the wound. And after that, if there is improvement or if the patient needs another kind of dressing, Alhamdulillah, the government implemented, you know, a lot of delivery services, cars, to take the medication and to take the dressing material to the patient's home, even if he's living outside Jeddah, like Makkah, Medina, near cities. So they deliver the things to his house and to his door, so he will not come to the hospital, especially during total lockdown. So our patients, they were followed up by the pictures, and we sent them all the items they needed at home, especially stoma patient equipment, which they needed every time to care for their stomas. It is critical to balance the benefit of alteration to current practice to reduce the chances of COVID-19 infection with the potential long-term impact on patient. Expert opinion and the best available advices was taken from the expert people and from the key stakeholders to implement this in the hospital. Also, another thing important to manage and to mention that the hospital goes through the employee files, and any post-cancer case or any employee having low immunity or they are having multiple chronic disease, they give them off to stay at their home and to stop working, and they will still get their salaries, but at least to make them away from the getting the virus. And yes, the work was affected a little bit, but anyway, everything was less that time. Managing of chronic wounds patient during COVID-19 pandemic. During COVID-19 and following the first reported case in Kingdom Saudi Arabia, has taken addressed infection control measures that include adapting different models of recognizing infiltrated, reallocate the resources, deal with pandemic. As I told you, we provide materials, we provide dressing, we provide medication to be sent to patient home. A reduction of elective surgeries. Many elective surgeries was stopped that time. Only very important and necessary surgery can be done with caution also. Stop also outpatient clinic was stopped unless there is emergency and very important case. So we asked the patient to do COVID-19 swab 2 days before attending the hospital, and then introducing ER workflow and minimizing COVID-19 cases flow through the main ER. So patient was limited accessing the hospital, and that make it reduced to have the spread of the infection. Government also rent a special hotels and hospitals to isolate positive or suspected cases of COVID-19. And also they close all mosques, including Makan, Medina, Holy Mosque, and that helped to control cases. Because as you know, the crowded area, especially during Hajj time, and the damage which the patients have in crowded area, especially diabetic foot patients, make increase in the number of diabetic foot or traumatic foot patient in our hospitals after Hajj or after Umrah season in Ramadan. So we have decrease in the number of these cases after the lockdown of the two holy mosques and not allow people to go for Hajj for this year. And that make it okay for us to follow the routinely patient coming to us before. So the number is decreased comparing with before COVID-19 period. Reduce all sectors health work load to ensure healthy environment. Social distancing, as my colleague mentioned before. So we follow that social distancing even in our work environment. So the office which will accommodate 10 persons, we just give 5 off and we keep 5 working every day. Close all hospital gate unless emergency cases. Most of patient care, especially special department, were closed and shifted to bedside nurses to help COVID-19 unit to cover all the gap of reduce the number of nurses or reduce the equipment or increase of the number of the COVID-19 patients. How was the effect of wound care practice during this pandemic period? Wound care practice was severely affected during pandemic 2020 period till present and is still affected till now because with the new wave we will start suffering again. The number of specialized wound care nurses become less and zero in some of the hospitals. They were all shifted to bedside nurses. Some of them, they are away from bedside nurses for 10 or 15 years, but they try to manage. Most of the patient follow-up appointment was canceled or delayed. Patient instructed to change dressing at home and caregiver and family will take advices by phone and by photos also. Lack of dressing materials because of stopping airport services and importing dressing from outside. So we are working with what is available until they open the flight to come in with the new materials. Next, please. Now to speak about chronic wound, we have first to define what is wound. The wound defined as a breakdown in the protective function of the skin, the loss of continuity of the epithelium, or without loss of underlying connection tissue, like muscles or bone or nerve. Following injury in the skin or underlying tissue organ caused by materials, pressure ulcer also if under instant pressure, resulting in a disease such as leg ulcers or carcinoma and different kind of wounds. What is chronic wound? Chronic wound are defined as wound that fail to proceed through the normal paces of wound healing in an orderly and timely manner. Often chronic wound stall in the inflammation base or healing. And as we know, any patient, any wound will take more than 14 days. We will consider it chronic wound already, and we have to deal with it as a chronic wound, not acute wound. And there is many factors affecting wound healing. I am sure all of us knows that factors. From these factors, if the dressing is not doing regularly or you are not doing using a proper dressing materials, or you are not coming for proper assessment, or a lot of factors like nutrition, like pressure, like all this affecting chronic wound. So we have to take attention to these factors. Chronic wound includes, but not limited to, diabetic foot ulcer, venous leg ulcer, arterial leg ulcer, pressure ulcer, and malignant wound. Post-surgical wounds also, if it will not heal during 14 days, so we will consider it chronic wound. Dehisced wound as well. After the wound is closed and everything, it will become dehisced in a period more than 14 days. So we will consider it chronic wound, and a lot of kind of chronic wound. As I told you, our evaluation should be healing during 14 days. If it exceeds 14 days, we will consider it chronic wound. Some common features shared by each of these wounds include, chronic wounds, prolonged or excessive inflammation. It will appear like inflamed, persistent infection on and off, and formation of drug-resistant microbial biofilms. Some wound will produce biofilms which will not allow it to heal in the timely manner. So we have to take care of these biofilms. Inability to dermal and or epidermal cells to respond to repetitive stimuli. And you are doing the dressing many times, but the epidermis and dermis is not responding to what you are putting in the wound, and the wound healing will be delayed. So we have to interact to remove all these barriers for healing. The underlying pathologies also, however, differ among virus types of chronic wounds. We cannot evaluate all chronic wounds as each other. We have to look at the intrinsic factors affecting the wound healing and the extrinsic factors to evaluate the wound, especially if it's not healing in the same time. Facts that we should all know that understanding and addressing the challenge in the treatment of chronic wounds will lead to better clinical outcome, faster and more durable wound closure, and also resulting in improvement patient quality of life and reduce healthcare costs. Consume a great deal of healthcare resources around the globe. all of us knows how much it is costed to take care of chronic wounds, especially if the patient admitted to the hospital for management. Managing chronic wound, it takes a lot of cost of the hospitals, and it takes a lot of materials, a lot of investigation. That is why we have to limit that, and we have to do proper assessment and to follow patients at home as much as we can, and to try to work to fix intrinsic factors like age, nutrition, other factors, and to address pressure, environmental effect, some kind of materials not to be inside the wounds, like this. So we are working to control the environment of the chronic wound, will help to close it faster. As we all know how complicated is caring for the chronic wound. So we have to assist all these factors and to work through it. So we have to see what's the environment the patient is living in, what intrinsic factors he is having, what extrinsic factors might affect the wound from his area, what is the assessment, proper assessment of the wound, what's the wound bed looks like, and what is the age of the wound looks like, what can affect that, what is wrong practice the patient doing at home, so he is affecting his wound healing. If he is putting pressure on the wound, if the wound is contaminated with urine or stool, if the edges of the wound is macerated and it needs debridement, what material he's using, is he doing the dressing properly, or if he needs to come to the clinic to do that for him if it's complicated, if he needs to use the vac machine, vacuum therapy, to help in the control of the oxidate. What is the oxidate like? All these factors also affecting the wound healing and affecting the cost of the hospital and affecting also the patient cost, because some people, they are living away from the hospital, so they need to travel to the hospital every time for dressing or for admission. So we have to control all these things and to look after it, especially now during pandemic period. We have to make the patient much comfortable at home with providing all resources and all follow-up while he's at home, and teach the family members or the caregiver to take care of all things we can do here in the hospital. Wound care situation in Saudi Arabia. All the non-urgent hospital services have been postponed. Unsurprisingly, that a major at-risk population are patients with chronic wounds, as they often suffer from severely underlying comorbidities such as diabetes, cardiac disease, and hypertension, respiratory diseases, in addition to old age and traumatic injuries, intensity, susceptibility, or COVID-19. In fact, untreated chronic ulceration can even be an entry door for secondary infection. When we neglect the wounds, especially with the patient with a lot of comorbidities like this one, so this wound might be entry for another comorbidities for the patient. It might be infected, it might be ischemic, and they will lead to amputating the part of the ischemia. So we have to pay attention, even if the patient is not attending to the hospital. We have to call the patient whenever we see the patient need to come to the hospital. And if still the rise of pandemic cases, we have to ask the patient to do swab 2 days in advance and bring the patient to evaluate the situation in front of us. Because sometimes you cannot see clearly from the pictures and from the details of the patient. Solution during COVID-19, I'm speaking about our country and what we follow, like many other countries around the world. Telemedicine also should be considered the best way to prevent the spread of COVID-19 and to provide relevant care to chronic wound patients. At the same time, it is important for the specialist to keep link with patient. As I told you, we have to follow our patient in timely manner to ensure that everything is going okay when they are at home. Non-surgical method should be considered also where possible for patients with development or chronic orthopedic condition. It may be possible to delay the treatment from 2 to 4 months sometimes without without subtension of the termination of long-term impact. We can ask the patient to delay the care sometimes if the wound is okay and stable, just to continue the same care, and we can delay any procedure for 2 or 4 months until the time is allowing to bring the patient to the hospital and do the care. But when we feel it's dangerous to keep the patient away, as I told you, we can ask the patient to do the swab and come to the hospital for proper assessment. Complete cessation of professional or wound care during restricted healthcare visit may expedite this chronic wound into actual acute wound with irreversible system damage. Because when we neglect require quick action, so we have to be careful and to do proper assessment for those wounds. Always keep the control with the patient, including telephone, cell, and photos of the lesion, and check it weekly. Assess by phone the presence of signs and symptoms like pain, redness, heat, swelling, drainage, and ask the patient to describe the wound carefully to you. Educate the patient and the family to how to perform the wound care. As a treatment in general for chronic wound, can you go to the next slide? Medical management, as we know, we have to treat problems. If oxygen problems, we have to assess and make sure from all these intrinsic factors affecting wound healing. And then vascular, if the patient is having vascularity problem, we have to revascularize the part of the wound and to give more oxygen. And if the patient needs hyperbaric topical oxygen also to enhance the wound healing. Next slide. Next slide, please. Yes. We have to control the infection, like drainage, abscesses. If there is abscess, we have to drain it. We have to debride the wound. We have to treat the osteomyelitis and give the antibiotics. We have to do proper wound care. If the patient needs sharp or autolytic debridement, or if he need wound bed preparation, also we have to be ready with that. And offloading, we have to be sure what offloading materials the patient is using and if somebody is prescribed it for him already or not. And if the patient is putting the wound under pressure, we have to take care of that. In conclusion, COVID-19 is highly affected and the healthcare system, as the number of confirmed cases goes up before and now it might goes up again, as they is saying. The shortage of medical resources has become a challenge. Integrating telemedicine into wound care during the outbreak helped to maintain social distancing and help to reduce the number of cases and to avoid collapse of the healthcare system during the fight with COVID-19. all healthcare workers, including wound care practitioners, should adapt to new rules and use only appropriate method available to slow the spread of this virus. Those are my references, and thank you so much and stay safe.
Okay, thank you, Miss Asia.
Welcome.
So for the next, we will be wait for questions from the audience for you. Okay, I give 2 minutes for the questions. Oke, silakan yang mau bertanya bisa ditulis di kolom chat ya. Yang mau bertanya pada Miss Asia.
Miss Sarah, I want to ask my sister from Kingdom of Sarabia, Miss Asia. Miss Asia, I'm happy, very, very happy today I meet you via Zoom. I want to ask for you, how to management in diabetic foot ulcer in your hospital during pandemic 19?
As you all know, diabetic foot ulcer is not a short period ulcer. The minimum time for diabetic foot ulcer may be more than 1 year. Okay, so we know our patient already, and we discharge a lot of patient was admitted to manage diabetic foot ulcer, and we follow them at home. But as I told you, the telemedicine, we ask them to send picture weekly and follow them, and if they need any sharp debridement, that's the time we ask them to come to the hospital, but they have to do the swab before that and come for sharp debridement and for proper assessment. Otherwise, we just send them the dressing materials with the delivery cars to home to do the dressing by themselves, and we direct them. Sometimes we send them videos about how to do proper dressing, and the most important thing, we give them advices to control their blood sugar, to have the effect of the dressing with the control of blood sugar, so the wound will heal.
Okay. Thank you, Miss Asia, for that answer.
Okay, Miss Asia. So what the limitation are there? Is a limitation the medics in the Saudi Arabia to cure or to treatment the patient in pandemic?
Which patient you mean? Wound care patient or patient in general?
In general.
In general,
the limitations as a medic.
Alhamdulillah, we did not experience that limitation, that much limitation, because as I told you, there was a special advices from the key stakeholders and from the opinion people, how to control everything, how to discharge patient, how to follow them up, and they make all services available to bring their medication to their home and to make everything is available for them to do the same care at home. I'm sure it wasn't the same care like if they are in the hospital, but at least the most important things were sent to them to follow the special and to follow the same care at home. So we didn't feel that much limitation.
Okay, Miss Asia, thank you. Okay, Miss Asia, there is a questions from the audience. So I will be read the questions. How long the time required to find out that our wound care, including drug-resistant antimicrobial biofilm, are there any special things, and what should we do?
Can you repeat it again? I cannot understand.
Okay. Sorry, my signal is bad. Okay, the question is from DSA. How long the time required to find out that our wound care, including drug-resistant antimicrobial biofilm, are there any special things, and what should we do?
For any patient, any chronic wound, we should try one kind of antimicrobial dressing for 1 month. If there is no improvement, it means the wound is not responding to what we are using. As I told you, we have also to look at the oxidate and at the signs of inflammation, what we can put. Some people with highly exuding wound, we need to use the vac machine therapy to control the oxidate and to activate the wound edges to close. So proper assessment will tell us what we need and for how long we can interfere and change the dressing method.
Okay, thank you. So there is the next questions from Siti Nurjana. The question is, telemedicine for wound care till COVID, are that effectively?
Yeah, I
Okay.
can
you
consider
get the
it.
point, telemedicine?
Yeah, I can consider it effective because I am using that with my patient with the stoma now. Any patient with peristomal skin complication, even before COVID-19, we are using the telemedicine. They will send us the picture, we will give advices, and then they will go with that advices and we will evaluate the improvement. Because many of our patients, they are living away from the hospital, so we cannot bring them every time. And during pandemic, also we benefit a lot from this telemedicine because they keep sending pictures to evaluate. I'm sure there is some part of the assessment is missing in the telemedicine, but we can do whatever we can to help them to go through this period. And it was very helpful. And I think internationally it was followed everywhere.
Okay, thank you, Miss Asia, for your nice answer. So there's a lot of questions. I think it's enough. So thank you for Miss Asia for your nice insights in this seminar. Okay, assalamualaikum warahmatullahi
wabarakatuh. Thank you so much for you, and thank you for the invitation. Waalaikumsalam warahmatullahi wabarakatuh.
Saya kembalikan ke MC. Suara, Mbak Indri suaranya belum.
Terima kasih untuk saudari Sarah. Sebelumnya, before that, I want to say thank you for the sponsor to support this event. From Klinik Gria Husada Kediri, Diabetic Connection, Indonesia Care Center, Stop Amputasi Kaki, and Granulox. Big thank you for support this event. Mungkin untuk pembicara selanjutnya mungkin.
Oh iya Mas.
Ya.
Ada. Iya. Oke, buat semuanya kita masih satu pembicara lagi yang kemarin ditunda, yaitu materi dari Bapak Hamka. Masih tentang rawat luka. Yang hari ini akan materinya diwakili oleh disampaikan Bapak Asmat Burhan. Halo Bapak Asmat Burhan.
Okay. Thank you, Miss Sarah. Sorry ya.
Iya.
Oke. Saya mau menyapa dulu untuk partisipan. Gimana? Are you okay? Dengan bahasa Inggris. Oke, ada yang oke. Berarti sudah menguasai, sudah tahu apa ya yang sudah di-sharekan oleh Miss Suchengu, Jasmin, dan Eisiah Abbas ya. Oke, kali ini karena pahamkannya tidak bisa, saya diwakilkan untuk saya men-sharekan ilmu tentang the role of stoma complication ya, the role the nursing management kompetensi. Oke, saya coba. Oke, apakah sudah kelihatan?
Sudah.
Oke.
Udah.
Oke. Jelas. Thank you. Oke. Thank you for opportunity because Mr. Hamka, nothing is not a presentation in my topic. This is don't only want to create the material best practice management complication stoma, but this the material is the group. The team is yours. And today, best practice management complication stoma and the role of nursing competency. The very important for nursing in Indonesia for hospital with the stoma care or the post operative cancer colon or the stoma colostomy or ileostomy or the urostomy. Okay, my background in the world, according to the times, complication of stoma and peristormal began to decrease before the increase the 18%. Now the increased 14%. And how about in Indonesia? In Indonesia, still data for stoma care. Nothing is the data because maybe in Indonesia low for the research in the stoma care. However, or the actually stomach care very important because the the problem and difficult for the patient care in the stomach care, the stress from stress and the phases and management care in the dermatitis or the toothpiece or the pockback. Yeah, this is the strategy and tricks for the management competence in management the change of the two piece or the one piece in the stoma bag. In this is your look the participant. This is stoma good. Yes, this is the in the abdomen. This is the healthy stoma in the loop or the permanent. This permanent. Kalau permanen itu dia selamanya ya pasien dengan stoma. If you're the continue, dia hanya untuk mungkin tertabrak mobil, kemudian ususnya rusak, kemudian ada Hirschsprung disease ya pada anak kecil, dia dibuatkan untuk sementara. Jadi nanti setelah ususnya dia baik, akan dikembalikan seperti semula. Nah, tapi untuk yang permanen, dia akan anusnya akan ditutup ya. Dan selamanya tidak buang feses pada anus tapi melalui stoma. And the prevalence early the complication the 27.7% in Indonesia ya. Sutomo Hospital from the Abdul Syukur 2009 and the ileostomy and colostomy 50% 39%. Urostomy, different ileostomy, and after radiotherapy, Crohn's, colitic ulcerative, child or adult, emergency and elective. Complication stoma, early the complication, necrosis, bleeding, retraction, and the leaking. The later complication, the mucocutaneous, the separation, the prolapse for the stoma in the oath for the skin, and the hernia to the terjebak di daerah perut ya di dalamnya, and stenosis itu masuk ke dalam untuk stomanya, and fistula for the lung for the antara kolon dengan kulit, and the trauma. And the stoma necrosis. This look my picture in my slide. This is the necrotic for the post after operative colon cancer for descendant. And the cause, the characteristic of the trauma of blood vessel, and the blood vessel is defensive during the surgery. Ini sudah sangat jelek sekali ya untuk stomanya ini, dan ini untuk tanda dan gejalanya pale or the cyanosis ya, dia sudah menghitam. Management above the fascia or the conservative and below fascia intermediary exploration or the revision colostomy. Jadi kalau sudah seperti ini dioperasi ulang karena ada apa ya, terjepit di sini untuk vaskulernya, sehingga kalau tidak dibetulkan langsung dia akan terus naik ya ke usus-usus yang selanjutnya. The prolapse stoma. The prolapse stoma is stoma the out from in the skin. Ini ya, dia keluar dari perutnya. This the done before the pre-operative or the post-operative, nothing the assessment and the stoma setting. So stoma setting don't apply or use. So the stoma, the prolapse or the in the skin, this is the real loop, and they very pain for the patient. And the cause, the inadequate hemostatic, hematocard, the abronitatic, and the post of trauma or the rupture, sign the fresh blood output. Management, change the podcast used to piece a stoma bag and look for the source of the blood around the stoma or the inside, collaboration with a team. Ini maksudnya adalah manajemennya dari stoma bag yang one piece itu dia wafernya itu apa ya? Mungkin ada tahu ya stoma bag yang pakai plastik tahu atau plastik gula ya. Ya, dia tidak sangat rekomendasi untuk dilakukan pada pasien dengan prolaps stoma. Jadi harus diberikan dengan tupis ya. Tupis itu maksudnya dia agak tebal, jadi sehingga dia akan menekan si stoma tadi yang keluar agak ke dalam gitu. Tapi dengan aktivitas yang berbeda. And the retraction stoma dia tidak tidak menyatu dengan keadaan di sekitar kulitnya, sehingga atau fesesnya itu dia keluar kemana-mana, sehingga berisiko terjadinya dermatitis, dermatitis for the infection for the skin ya. Sangat banyak ini ya problematika dari stoma ya. Actually to the wound care, the basic sebenarnya untuk luka itu datang dari stoma ya, karena stoma ini terlalu banyak problem sehingga memang dibutuhkan perawat luka yang mengerti tentang stoma. Excuse me for the voice, the unmute. Okay. Okay, I'm sorry, I am unmute. And the deeper the complete, the partial below skin level management, use the convex spots and the mucocutaneous stirring, benar-benar dilakukan lagi untuk jahitannya ya, and the complete freedom from the tension. The late complication, ini untuk jangka panjang, mucocutaneous separation, ini ya sudah ada infeksi, slop dan nekrotik di dekat-dekat jaringan perbatasannya ya. Ini sangat-sangat berpengaruh ketika tidak dilakukan manajemen, dia akan membuat gap ya, atau membuat space ya antara stoma dengan kulit, sehingga apa? Akan memunculkan infeksi, dan yang paling final adalah dia akan jadi retraksi, dia akan agak ke dalam nanti stomanya ya. The cause the abdominal distension, stasis, the take longer, or the infection. Skin side the stoma is not attached their skin, their slug, necrosis ya. Management to piece the pocket, to piece the stoma back guys ya. Jadi mungkin nanti akan ada ya mungkin webinar untuk menjelaskan tentang stoma back two piece, one piece for the patient prolapse, or for the patient hernia and urostomy or the ileostomy. Mucocutaneous separation, this is the hydrocolloid, yeah, or the debridement or the mechanical debridement to use the necrosis or the slough, and you use the hydrocolloid, the gel from the prevent to infection and support the granulation and epithelialization in the eroding peri-wound skin in stoma. And the prolapse of ileostomy, the cause the improlapse contraction and not on the sighting. very important to nursing in Indonesia because very important to stoma setting before operative in stoma, because the stoma setting improve in the patient in patient care in the future, because nursing will akan selalu berada di dekat pasien. Jadi ketika pasien ini akan dilakukan operasi, Anda akan melakukan stoma setting ya. Stoma setting di mana ini adalah standar operasional prosedur yang bisa dilakukan, yang saya tahu sih di Hospital Siloam Dr. Sutomo ya, dilakukan stoma setting, and untuk mungkin yang RSUD atau klinik ya, saya kurang mengerti apa sudah ada nursing atau perawat dengan kompetensi di stoma setting ya. Karena ini benar-benar dibutuhkan. Jika tidak dilakukan, ini akan jadi hasilnya. Ketika sudah begini, kita akan repot sendiri ya. Dari dokternya, dari perawatnya, dokternya sendiri harus bedah digestif ya. Dan perawatnya harus yang punya kompetensi di stomach care seperti itu. Tandanya ya, usually the complainant the parastomal hernia and anxious, the worried about the appearance of the stoma. Management use the largo to pick what stoma back, then exercise the resident the segment and fix the colon the laterally, if recur the resitting the stoma. Jadi kalau sudah sebegini, rekomendasinya adalah untuk operasi lagi, dan operasi untuk stoma belum dilakukan BPJS ya. Sementara untuk Yayasan Kanker Indonesia dan untuk tempat dermawan yang lain ya, seperti jasa pelayanan untuk gratis itu belum ada. Jadi memang untuk operasi stoma ini sangat mahal ya. Jadi benar-benar dibutuhkan dokter yang kompeten dan perawat yang kompeten untuk merawatnya, karena setelah operasi itu nanti perawat yang akan menjaga selamanya dia, mulai dari sholat kalau dia muslim ya. Kan nggak lucu ya ketika sholat nya keluar najis kayak gitu. Kemudian lagi hubungan dengan suami istri, ketika lagi melakukan sunnah Rasul, ketika itu nya keluar, itu akan menjadi sebuah problem ya. Dan ketika dia bekerja, beraktivitas, semuanya akan menjadi masalah ya. Tidak dari pengalaman saya itu banyak pasien yang bunuh diri atau meninggal ya, karena memang kebutuhannya yang sangat besar di pasien stoma. Management prolapse the colostomy is the stoma bag, the big stoma bag ya, harus besar stoma bagnya karena untuk menampung stomanya ini. Dan ketika dia berdiri dia akan keluar, ketika dia tidur dia akan masuk ke dalam. Dan ini harus benar-benar dilakukan operasi ya. Karena ini juga akan menjadi sebuah tidak kenyamanan, kemudian stres, aktivitasnya juga terganggu, dan yang pasti ini agak nyeri ya kalau dari pengalaman untuk pasien saya. And the management the peristomal hernia, the cause the kegemukan, muscular weakness in all ya. And the complaint local pain, dia sangat nyeri karena memang dia menekan saraf di sini ya. The podcast the management is difficult. Sangat sulit dilakukan pemasangan stoma bag jika seperti ini. Dia akan selalu lepas ya, karena dia agak keluar ya. Ini mendorong ke luar dia, sehingga stoma bag tidak rekat di sini. And the management relocation the stoma, use the flexible the bag ya. Berikan stoma bag yang fleksibel ya. Tapi yang fleksibel itu sangat mahal. Kalau nggak salah harganya 450. Ya, itu untuk 7 hari ya. Dan ketika pasien ini yang ekonominya merendah, sangat sulit untuk didapatkan. Kemudian you extra the adhesive, use the right the stomach corset and reduce the stenosis the activity. And the management stenosis, stenosis ini dia masuk ke dalam ya stomanya. Scar and previous stoma and ischemic of the separation of the mucocutaneous junction. 96% will respond to local excision and need resitting. Liquid or rebound like told the flatus more often abdomen uncomfortable when they're defecating, and there is mist around the abdomen. Dia juga merasakan nyeri ya di sini ya, dari pengalaman saya merawat pasien dengan stoma. Dan ketika dia akan feses ya, dia akan keluar tidak beraturan di sini. Dia akan jadi meluas. Yang seharusnya ditampung, dia akan menjadi risiko tinggi terjadinya dermatitis, kemudian skin damage di sini juga akan merusak di situ. Manajemen use convex foods. Dia dilakukan untuk tupisnya atau wafernya ya. Perekatnya dia bentuknya kovet, cembung ya. Kemudian perform regular digital dilatation starting with the smell of the finger. Use the laxative to soften the stool and the collaboration with team for stoma repair surgery. Kalau seperti ini memang benar-benar dilakukan di repair lagi untuk surgery-nya, operasinya. Manajemen stenosis. Stenosis dia di kulit-kulit sekitarnya itu agak keluar ya, beda dengan stoma dengan hernia. The presence of fried objects, so threads and after some came out spontaneously and such as the flesh to gross and bleeds easily. Management removes to body causing the granuloma and the evacuate the granuloma with silver nitrate or thread ya. Yang di sini nanti bisa diberikan silver ataupun ya gel ya untuk lebih mengurangi adanya nekrotik dan stoma. Healthy stoma, don't forget most stoma are not problem. Jadi stoma yang bagus seperti ini ya, seperti bibir kita ya, yang cuman kalau untuk pasien dengan stoma atau yang disebut dengan ostomet atau ostomi ya, dia bibirnya ada dua, yaitu di atas dan di bawah, dan bentuknya sama, harus bagus. Stoma yang baik dia berwarna merah dan tidak ada infeksi atau kemerahan di daerah kulit sekitar stomanya. Thank you.
Oke, terima kasih untuk Pak Burhan yang menggantikan materi dari Bapak Hamka. Mungkin ada yang mau bertanya?
Mungkin ada yang punya pasien stoma di sini.
Materi tentang manajemen, mau tanya nih. Misalkan kan dengan pasien dengan pakai stoma, kemudian perutnya distended. Nah, itu salah satu teknik untuk mengurangi distendednya seperti apa? NGT ataukah dengan dimasukkannya darum base lebih efektif mana?
Gimana pertanyaannya kok kurang ini ya?
Putus-putus sinyalnya.
Ya.
Sudah dengar? Sudah jelas?
Oke, sudah jelas.
Misalkan ini ada pasien dengan stoma. Nah, pasiennya tersebut perutnya distended atau kembung. Nah, salah satu cara paling efektif untuk mengurangi distendednya itu seperti apa?
Oke, nice question ya. Kalau dari pengalaman saya untuk pasien dengan kembung ya, dengan pasien dengan kembung dengan stoma begitu ya?
Ya.
Oke. Yang pertama dilakukan adalah manajemen kembungnya dulu. Bisa melakukan dengan NGT atau bisa dengan treatment mungkin laksatif atau yang lainnya. Tapi kalau untuk stomanya sendiri, karena stoma itu di luar ya, ada di out ya. Jadi kita bisa lakukan untuk keduanya. Jadi yang pertama bisa dilakukan dengan NGT untuk memenuhi nutrisi. Karena kembung itu sendiri datangnya bukan rata-rata bukan dari usus ya, tapi dari lambung ya. Seperti lambung. Itu. Jadi jika dari kondisi lambung atau distendednya itu berkurang, maka stomanya juga akan ikut menormal seperti itu. Jika distendednya tidak dilakukan dengan baik manajemennya, maka akan muncul masalah pada stomanya, bisa terjadi prolaps atau nanti hernia ya pada ini, atau stenosis juga bisa pada pasien dengan yang memiliki stoma begitu. Apalagi di Indonesia very wonderful in the stomach care ya. Memang di Jawa Timur aja ya, saya di Jawa Timur itu cuma ada 2 spesialis dokter spesialis digestif ya, di Sutomo dan di Hospital Siloam. Selainnya saya kurang mengerti untuk dokter bedah digestif. Dan untuk perawatnya sudah kompetensi juga ada di dua tersebut untuk yang sudah mendapatkan lisensi untuk melakukan stoma sighting. Jadi kalau di luar negeri, sebelum melakukan operasi, dokter bedah digestifnya akan melakukan rujuk ya atau konsultasi dengan perawat stoma ya yang sudah memiliki lisensi. Jadi di mana letaknya dan bagaimana si perawat tadi akan mencari solusi tidak akan terjadinya komplikasi yang seperti saya jelaskan tadi, seperti itu.
Oke, terima kasih Pak Burhan. Mungkin teman-teman dari audien ada yang mau bertanya secara interaktif, bisa langsung menyapa. Ya, mungkin ada yang mau tanya secara interaktif, bisa langsung melambaikan tangan. Nanti kita unmute. Oh iya, ini Pak Burhan ada yang mau bertanya.
Ya.
Dari Mbak Dewi Purwati. Pertanyaannya, mengenai perawatan luka pada stoma bisa menggunakan hidrokoloid ya. Nah, untuk tingkat keefektifannya dan tingkat kesembuhan pada luka stoma menggunakan hidrokoloid berapa lama ya, Pak? Dari saudari Dewi Purwati.
Okay, your question nice from Dewi Purwati. Dari pengalaman saya ya about my experience to patient stomach care to use the hydrocolloid. From hydrocolloid itu prevent ya, mencegah and supporting to granulation from the gap or the wound in the peri-wound surrounding in wound the stomach area. Jadi di stoma ya, di sekitar stoma itu biasanya terjadi gap, bisa diberikan hidrokoloid. Tapi di sini hidrokoloid itu dia mencegah ya atau melindungi kulit yang sudah dermatitis atau infeksi yang kemerahan tadi ya di kulit di sekitar stomanya. Jadi untuk kesembuhannya sendiri ya, yang pertama kalau dia hidrokoloid atau lukanya dia derajatnya stadiumnya 1, dia akan 90% dia akan bisa mensupport penutupan closure wound ya atau penutupan luka. Tapi kalau dia agak ke dalam, dia akan susah kalau pakai hidrokoloid. Saran saya pakai hidrokoloid yang powder ditambah mungkin dengan apa namanya ya, kalsium alginat ya di dalamnya sehingga supportnya lebih cepat ya. Tapi my experience for the my patient stomach care ya, saya lebih sering menggunakan hydrochloride powder karena memang bagus sekali di sana untuk manajemen gap ya di kulit sekitar stomanya seperti itu. Sarah, you're unmute. Your voice unmute. Okay.
Maaf.
Well,
Terima kasih
welcome.
untuk jawaban dari Dewi Purwati. Oh, ini ada pertanyaan lagi, Bapak. Dari saudari Siti Nurjana, apa tingkat bahaya ketika stoma itu prolaps?
Oke ya. Tingkat bahayanya pada pasien dengan stoma dengan prolaps ya. Yang pertama, dia akan mengurangi cairan ya. Cairan yang seharusnya bisa tertampung di usus karena dia keluar, dia akan cepat dehidrasi di sana. Because cairan kan usus juga dia menyerap mineral, sebagian mineral dan cairan di dalam usus itu. Yang kedua, bahaya yang kedua, dia stres ya. Jangan sampai dipermudah ya. Jangan sampai kalau bahasa Jawanya itu dientengi. Banyak pasien dengan prolaps itu stresnya itu tinggi karena memang ngeri ya, ngeri sendiri lihat prolaps ya, dan manajemen stresnya itu sangat perlu dilakukan, karena pengalaman saya jika tidak dilakukan itu pasien bunuh diri ya. Jadi benar-benar kompetensi seorang perawat palliative care ya, palliative care or the stomach care itu benar-benar ditingkatkan, karena memang gawat daruratnya untuk pasien dengan stoma dengan prolaps adalah dua ini ya. Yang pertama dehidrasi, yang kedua adalah dengan stresnya. Oke, Miss.
Baik, terima kasih untuk jawabannya. Kemudian selanjutnya masih ada pertanyaan dari Mbak Indri Fitria untuk Pak Burhan. Pertanyaannya yaitu, pada stoma yang nekrotik, apakah harus dilakukan operasi kembali dengan resesi usus atau pengalaman dari Pak Burhan masih bisa dengan perawatan home care?
Oke, thank you Miss Indri Fitria. About my experience to management necrotic, ya, to manajemen perawatan stoma dengan necrotic, kita lihat dulu ya. If there stoma, dia after post operative ya, 2 kali 24 jam dia terjadi nekrosis ya pada stomanya, langsung lakukan recovery ya, atau operasi ulang, karena efeknya sangat cepat sekali jika nutrisi dan O2 terjadi masalah pada vaskuler ya, sehingga dia akan terus ke atas. Tapi jika setelah operasi ulang kemudian dilakukan perawatan tapi ada nekrosis ya, kita bisa lakukan home care. Itu penyebabnya karena ya infeksi ya, nya keluar atau fesesnya itu keluar, tapi tidak termanajemen dengan baik ada di atas. Biasanya dengan eliostomi ya. Kalau kolostomi kan agak padat ya. Kalau eliostomi itu biasanya agak cair dan dia sangat banyak kali komplikasinya di kulit sekitarnya. Kalau ada nekrotik bisa dilakukan dengan hidrogel ya, hidrogel from dari kalbe or dari Cutimed gel atau yang dari duoderm Convatec ataupun zinc cream ya, Medcopacin atau smart garlic bisa sampai dia benar-benar hilang nekrotiknya. Kemudian jika nekrotiknya udah bagus baru dihilang, baru diberikan hidrokoloid seal or the hidrokoloid gel ya yang dimasuk di kulit sekitar luka untuk menjaga kelembapannya seperti itu. Bisa lakukan home care.
Oke, terima kasih baik untuk Pak Burhan atas jawabannya. Tadi udah 3 pertanyaan, jadi mungkin saya rasa cukup. Sekali lagi terima kasih pada Pak Burhan atas materinya tentang manajemen dari komplikasi stoma. Okay, there is the end sessions of the last day seminar, international seminar. So thank you to all participants who joined this seminar. Apologize me for any shortcoming regarding the delivery or organization of the seminar. And thanks to all the speakers who took the time to share these insights with us. And don't worry, wait for another interesting event from Go Eye Care Indonesia or Kriya Husada Center. And I'm Sarah Aulia as a moderator. It's a pleasure to host this seminar and representing the entire committee. Stay safe and stay healthy wherever you are. Nice to see ya. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih untuk Miss Sarah. Demikianlah Bapak Ibu serangkaian acara International Evidence Parties One hari ini. Kita sudah menyelesaikan selama 2 hari. Terima kasih atas perhatiannya. Dan tak lupa lagi kami ucapkan terima kasih kepada para sponsor, yaitu pada Klinik Ria Husada Kediri, Diabetic Connection, Indonesia Care Center, dan Stop Amputasi Kaki, sehingga acara ini dapat terselenggara dengan baik. Oh ya, saya sudah mengirim untuk absensi sertifikatnya buat Bapak Ibu, silahkan akses linknya, diisi dengan benar karena terkait akan pemberian sertifikat. Tapi nanti untuk pemberian sertifikatnya akan diberikan selama 1 minggu setelah acara ini berlangsung. Ini linknya hanya absensi saja. Untuk sertifikatnya akan diberikan 1 minggu setelah acara ini berlangsung. Terima kasih kepada Bapak Ibu. Sekali lagi saya ucapkan terima kasih banyak atas partisipasinya, kehadiran Bapak Ibu dan teman-teman. Mudah-mudahan acara ini dapat menjadi ajang silaturahmi bagi kita semua. Dan terima kasih banyak tentunya kepada para narasumber, sponsor yang pada kesempatan hari ini dapat hadir. Terima kasih atas perhatiannya. Mohon maaf jika ada kesalahan selama acara berlangsung. Saya Indri Fitrianingsih beserta seluruh panitia pamit undur diri. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Sampai ketemu. Boleh Bapak Ibu untuk mengakses link yang sudah ada sertifikatnya untuk absensi. Halo? Oke, Mas. Oke, Bapak Ibu, silakan untuk mengisi absensi sertifikatnya. Jadi nanti untuk isinya ada diberikan Google Form. Di situ lengkap harus diisi karena berkaitan dengan pemberian sertifikat mulai dari nama. Jadi benar-benar harus sesuai dengan nama. Nanti tulisannya soalnya akan diberikan untuk sertifikatnya. Tapi sertifikatnya diberikan 1 minggu setelah acara ini. Boleh Bapak Ibu sekarang untuk mengakses linknya untuk mengisi dengan lengkap di Google Form. Jika ada pertanyaan, boleh mengajukan pertanyaan, masih bisa. Satu lagi Bapak Ibu, untuk emailnya email yang diisi harus email yang aktif ya, sama email yang biasa digunakan, dan jangan lupa untuk passwordnya, soalnya ada untuk membuka email karena lupa password. Jadi email yang diisi adalah email yang aktif. Sekali lagi saya ingatkan untuk mengisi absensi sertifikat itu diisi dengan email yang aktif karena pemberiannya berkaitan dengan pemberian sertifikatnya.
Hemoglobin, the body's own transporter of oxygen. Introducing our simple and ingenious solution for chronic wounds. Granulox Hemoglobin Spray. Now for the first time, oxygen can be easily applied to chronic wounds, sprayed on during treatment. Granulox hemoglobin spray starts at once, transporting oxygen from the surrounding air down through the exudate to the wound bed. Here are the pictures again before Granulox was applied. And here's the measurement of oxygen penetration after Granulox. At last, chronic wounds can get the oxygen they so vitally need in order to heal. These are just some examples of the nearly 15,000 wounds which Granulox has successfully treated during the last 2 years. Oxygen is that essential for cellular life that Granulox is a benefit to the vast majority of chronic wounds, no matter if it's related to arterial or venous problems, diabetes, pressure ulcers, or even complex healing after surgeries or burns. As with every simple, ingenious solution, the Granulox story has spread rapidly. Although Granulox only entered the German market in the spring of 2012, it has already attracted distributors from all over the world. In just a short time, example after example of Granulox effective treatment of wounds are showing up in country after country. It's the beginning of a long-lasting revolution in the global treatment of chronic wounds. Welcome to the world of Granulox.
Around the world, there are 300 plus million people just with diabetes. We often see patients who succumb to wound infection because that enemy, that bacterial load, is very difficult to track. Healing wounds faster and better remains probably one of the most important battles that clinicians face. In fact, globally, wound care has been declared as the silent epidemic. Clinicians still can't see bacteria. Moleculite's technology makes that invisible enemy visible.
It's a very simple camera that you can take a picture and document the wound, and then you turn off the lights in the room, turn on the fluorescence, and you can see right away where there's fluorescence coming off that wound. The major benefits of the Moleculite camera is that it first it photographs the wound, so you have documentation of the wound. Secondly, you identify the bacteria, you identify where the bacteria is, and you start treatment early. You have a wound, and around the periphery of the wound, you may see that there's a staph infection, and in the center of the wound, there's a Pseudomonas infection. If I was just to take a swab, which I did before this camera was invented, I'd probably stick a swab right in the middle of that wound, get a swab that was positive for Pseudomonas, but missing the Staph aureus around the periphery. I'll also take another picture after debriding and see if it's a slightly different picture. The role of imaging in wound care is critical. It's essential that these wounds be documented, and the imaging can actually help diagnose what's going on with the wound, and it's a way of documenting progression of the wound. If anyone can use an iPod, they can use this device. If you're involved in wound care, this is an essential tool.
Biofilm, the hidden barrier to healing. Some chronic wounds struggle to heal despite the best and most appropriate care, even though they show no visible signs of infection or other complications. Recent clinical research indicates that the likely cause of these stalled wounds is the presence of biofilm. In fact, biofilm may be present in at least 60% of all chronic wounds. Constant low-level inflammation with flare-ups, which are often recalcitrant to antibiotic therapy, are now viewed as a sign that biofilms are present. But what exactly is a biofilm? Biofilm formation begins when single free-floating planktonic bacteria start to attach within wound surfaces. At this stage, planktonic bacteria are still susceptible to the host immune response or antimicrobial treatments. Moreover, their attachment is still reversible. As bacteria multiply, they become more firmly attached and are able to interact and communicate amongst each other through a mechanism known as quorum sensing. Such colonies become able to secrete a protective matrix known as extracellular polymeric substance, or EPS, composed of protein, DNA, and sugars. The transition from planktonic bacteria to a mature biofilm can occur within only 48 hours of first attachment. The EPS matrix provides a defense from host response, allowing bacteria to proliferate, and can also protect them from antimicrobials which normally kill planktonic bacteria. As biofilm matures, planktonic bacteria are constantly sacrificed and released from the biofilm cluster. This initiates the host immune response. However, neutrophils and macrophages that kill planktonic bacteria are not able to break through the EPS matrix of the mature biofilm structure. The result is a vicious cycle, leading to a constant inflammatory phase, a trait that's observed in virtually all chronic wounds. For antibiotics to be effective, bacteria need to be metabolically active. Bacteria deep within the biofilm colony are able to hibernate or enter a quiescent phase. While antibiotics may kill surface bacteria, the dormant bacteria remain unaffected, and the biofilm continues to survive. For an antimicrobial dressing to be effective, the EPS matrix must be penetrated to allow the antimicrobial to attack the bacteria within. Traditional antimicrobial silver dressings have not proven effective against wound biofilm, as it has been shown that the concentration of silver required to eradicate bacterial biofilm needs to be 10 to 100 times higher than that required to kill planktonic bacteria. Understanding how a biofilm behaves and functions is crucial to win the battle of stalled healing and to choose the most effective dressing for chronic wounds. Iodazole is a novel antimicrobial dressing made of Cadexima smart microbeads, spherical starch structures loaded with elemental iodine. It combines physical absorption and desloughing with a sustained, gentle release of iodine. Iodazole effectively addresses biofilm in chronic wounds. It is suggested that the Cadexima microbeads are able to dehydrate and directly destroy the biofilm structure. Once this protective matrix has been breached, the iodine can subsequently kill the exposed bacteria within the biofilm community. Iodazole comes in 3 different formats. They all contain Cadexima smart microbeads, delivering a non-toxic, sustained antimicrobial action. Iodazole should be the dressing of first choice to effectively tackle biofilm in chronic infected or non-infected